we must declare war on this virus.
From this evening, I must give the British people a very simple instruction. You must stay at home.
We declared a public health emergency.
Prepare if you are able to. Prepare to work from home if you can.
And for the key workers...
And they're tired. They have been heroes. They have been going above and beyond anything they might have thought they were signing up for. We need to help them.
In the beginning of 2020, the world faced a new challenge, a battle that had yet to be defeated. COVID-19, also known as the coronavirus, spread across the globe rapidly. During this time, there was not a straight answer to when the disease would end, so most governments ordered people to stay home to reduce the infection. However, not everyone could afford to stay in their safe homes, and millions of key workers, including healthcare workers, kept working on the front, sacrificing their health for others.
Up till June last year, I was working at a GP surgery in Cambridge that catered for 18,000 patients.
So my current job is as a consultant haematologist in a large teaching hospital in the Midlands.
Hola, me llamo María José, tengo 49 años y soy voluntaria en una organización de asistencia social.
There has been much discrepancy regarding what employment roles can be classed within the term key worker. You may initially think of NHS workers upon hearing this term. It has highlighted their importance for ensuring communities are cared for and that the country can overcome this pandemic.
So that you would do 4 quite busy, intense days and then have 4 days of rest. And the idea was that you would need some time and space to recuperate just for physical and mental health recovery.
We didn't really have a lot of measures in place for masks, etc. to start with. So we were having to try and create our own space.
Pues desde que empezó la pandemia hago turnos dobles de 4 horas, también de lunes a viernes.
And it became impossible to have 4 days on and 4 days off. So we were having maybe 1 or 2 days off after intensive shifts.
Pues por un lado, como ahora hago el doble de horas, pues me siento más cansada. Por otro lado, como trabajo con personas vulnerables, me preocupa el hecho de que las pueda contagiar o de que ellas me puedan contagiar a mí, en el caso de las personas enfermas de COVID a las que he atendido. Y al final, pues esa preocupación también influye en el cansancio físico y mental.
As the lockdown continued, it became clear that more than just NHS workers were key workers. Teachers, care workers, engineers, and delivery drivers had to keep working too.
It varies because teachers work on a salaried monthly basis, so we don't necessarily count hours. But an average work week is 9 to 3, so you're looking at 6 hours.
Basic hours are 38 hours a week. When it was busier, obviously there was overtime doing extra bits and pieces to get the workload through, because obviously it's a lot busier.
Some key workers, especially those in healthcare professions, felt a lot more strain than previous years. However, many key workers found that their workplace became a lot more supportive during the pandemic.
At work, there was a sense of camaraderie, and there was a lot of messaging at work about being kind to each other.
Sobre todo cuando atendía a personas enfermas de COVID, sí sentía que me ponía en riesgo. Lo asumía, pero me hacía estar muy alerta, porque si yo me contagiaba, sabía que podía contagiar fácilmente a las personas que conviven conmigo.
The nurses on ITU had a tremendous burden physically and emotionally. They're used to providing a certain high level of care, one-to-one care often, but because of the sheer numbers, it was 1-to-3 care, and they just couldn't maintain their usual high standards. And I was pleased to be able to, in a small way, to be able to assist the nursing staff on ITU on those shifts.
Whilst some of our interviewees felt they were risking their life, there was a mixed response to the Clap for the NHS initiative, which was later expanded to include all key workers.
Clapping for the NHS was the initial motivation, but I think just the whole community spirit, I think, took over, and it became one point in the week where we would all make greetings, and I think it was very encouraging, and it was something I look forward to.
We did the clap. We felt that we're doing our part, but whether that made the nurses or the key workers feel any different, I'm not sure.
Pues por un lado me parece bien que la gente entonces se animara a aplaudir porque nos sentíamos reconocidos en uno de los momentos más duros de la pandemia.
I don't think it really affected us for a little while, because it was just for nurses in the NHS. But you sort of used to think that surely we're key workers as well, because we were working through it when other people weren't in that. So
Pues siento que se nos falta al respeto y que el acto de aplaudir al final era más un acto un poco hipócrita.
As the disease was spreading, equipment was required to keep people safe. In the first lockdown, the government was taking a huge lead to help key workers by providing them essential PPE for their workspace.
They've done things that they can, but in other ways there's bits that possibly should have been done before that were done too late.
Básicamente, cuando empezó la pandemia, la organización con la que colaboro pues recibió material de protección como guantes y mascarillas, batas para proteger nuestra ropa y también equipos de protección individual para cuando tuviéramos que atender a personas contagiadas.
But I think there will be a need for staff support ongoing, especially psychological support. And hopefully the provision of that will be adequate. I mean, personally, I think our provision of psychological support to our patients is woeful. I think we need far more psychological input, and it's very difficult to access with the current system.
What the government's done publicly is fine. They've put a lockdown on, they've told people to wear masks, they've introduced social distancing, shops that are non-essential have been closed. So what the government's done on their half is great, and what the school has done is enforced masks being worn, hands being sanitized, just re-educating the students, no puns intended.
This look into the experience of key workers during the COVID-19 pandemic has offered insight for the rest of society. They have ensured that many services have maintained throughout the pandemic with minimal interruption.
You just have to be careful and make sure you stay safe yourself and keep others safe, really. That's all you can do, really.
Just tell them to follow government guidelines and just ensure that they are doing what they can do to stay safe.
Yo como voluntaria les diría que hay muchas personas que están prestando ayuda de manera altruista porque quieren y les gusta ayudar a los demás. Y esas personas no ponían en peligro su vida ni la vida de la gente a la que ayudaban antes de la pandemia, pero ahora últimamente sí.
Be careful, to be thoughtful, and to make sure that you're protected yourself before you do anything involving other people.
There was an element of anxiety and fear, but at the same time, it wasn't something that was overwhelming. I mean, despite knowing of and seeing people dying, it was just something that you just accepted. And I think you have to have courage. I think we all have to have courage in life, but particularly at that point, I think you had to say to yourself, come on, where's your courage?
As they have continually supported us, it is our duty to also support them.